Greetings, everyone. It's good to be here. Good to see some faces in the room. We're all, of course, gathered on the traditional territory of the Lekwungen-speaking people, the Esquimalt Songhees First Nation. And I'm very delighted to be back in the legislature for the first time in a year and a half with a full complement of members of the legislature. It's always an exciting time as a new member. I remember full well when I first took my seat on behalf of the people in my community to do everything I could to represent their needs and wishes. And it's heartening to see the new members of the legislature excited about taking on the tasks that they've been working at for the past year, but now with colleagues of all different perspectives surrounding them. We have an ambitious agenda this fall, working on our Clean BC roadmap, implementing the royalty review that was announced earlier today with respect to the oil and gas industry and the impact that will have on meeting our GHG targets to 2030 and beyond. Our child care initiative, working with the federal government to make sure that we can get child care for everyone who needs it, wherever they live in the province. And of course, critically important, the forestry reform measures that we've been working on for the past number of years. Again, I want to thank British Columbians for their efforts over the past number of months. We have unprecedented success with respect to vaccinations. Quebec and British Columbia share the distinction of leading not just the country but the continent on first doses and full immunization for 82% of the people in BC over the age of 12. And I'm advised by Dr. Henry and her team that in the weeks ahead, Health Canada will be reviewing plans to deliver an immunization program for children from 5 to 11, once that's been approved by the appropriate authorities. So although we still have unacceptably high case counts and disconcerting numbers of hospitalizations and people in the ICUs, this has become largely a pandemic of the unvaccinated, not exclusively, but largely. And that's why we're redoubling our efforts by bringing forward a vaccine mandate for public workers that are under the contracts with the province of British Columbia. Other businesses are doing that, large and small, as well as Crown corporations. BC Hydro will have more to say on that later today. And I'm sure there'll be questions about the role of BC ferries and their staff, which are federally regulated, and how that will work for those on the island and those ferry-dependent communities. But there's lots to do. Again, we're very grateful to be here on the territory of the Esquimalt and the Songhees, and I'm happy to answer any questions you may have.
Thanks. As a reminder to everybody on the phone line, please press *1 to enter the queue. You're limited to one question and one follow-up. We will start in the room today with a question from Rob Shaw, Check News.
Hi, Premier. Hey. Just wanted to ask you about the mandatory vaccination issue for school districts. It seems like your government's approach is to allow 60 different districts to vote 60 different times on this issue. And the rationale from the education minister is there's no provincial health order in place on that, if that's what she said yesterday. I know you don't want to second guess Dr. Henry, but would you prefer to see a provincial health order mandating vaccinations in school districts so we don't have this multi-week 60 district process that's going to unveil itself?
Well, first of all, and reiterate what I said at the top of the conference, that I am very proud of British Columbians voluntarily stepping up in large numbers to be immunized, to protect themselves, their family, their co-workers, and their community. Mandates are a last resort, and it is a very small number of British Columbians that are not yet vaccinated. And we have been working with the stakeholders, Rob, as you know, in the K-12 sector for some time, trying to build trust, trying to make sure that everyone has an opportunity to speak on issues, not just about vaccinations and COVID and masks and other things, but we need to make sure that the province school districts, which are duly elected and have authority and responsibility when it comes to their staff, are all having a say in how we proceed. I'm very cognizant of the notion of 60 separate decisions here, but it's good to see stakeholders, critical people like teachers, represented by the BC Teachers Federation, QP workers, the largest body of people in the K-12 system, their leadership saying that a mandate is the logical next step. And I'm confident that school districts will be agreeable to that. Dr. Henry and her team stand ready to work with everybody to get to the place we want to get to. Increasing the number of vaccines, protecting children, making sure that we can continue to reduce outbreaks, continue to reduce exposures, and get this thing behind us once and for all. But as I said, we are largely in a pandemic of the unvaccinated, and that's why mandates are being discussed, not just in this sector, but right across the board.
Do you have a follow-up, Rob?
Thanks. When you talk to MLAs from the north, it is a mess up there on vaccinations. Mike Bernier, for example, has many stories. I'm just trying to extrapolate how this strategy works for northern school trustees who are probably going to wander into meetings with intensely divided communities, immense pressure on them not to support mandatory vaccinations in communities where you need that to drive up the rates. And they're looking for the provincial leadership on that. So are you letting the northern school districts down by not taking a provincial approach that leaves them subject to this anti-vax movement that they're seeing in their communities?
Well, firstly, I want to commend MLA Bernier and MLA Davies, as well as personally, I've been reaching out to Dale Bumstead, the mayor of Dawson Creek, who have taken courageous and appropriate stands on these issues in the interest of protecting their communities. And the question is well put, and I understand where you want to go with this. We want to make sure that everybody is fully on board, and the MLAs in areas where immunizations are low, largely, and I don't mean this in a partisan way, largely in opposition ridings, have all done extraordinary work against the wishes of some of their constituents and supporters, and I commend them for that leadership. Every single one of them is going out of their way to protect people, and that's as it should be. I'm confident that as the days go by, that Dr. Henry and her team and school districts will be in sync, but these steps, quite frankly, are thoughtful, and they're done with the intent of making sure that everybody has a full understanding of why we're going in this direction after waiting so long for people to get that last step. We're at 88% first doses, heading to 89%. Probably by the end of the weekend. So there's a small group of people. They tend to be located in certain communities, as you say. But again, I commend the leadership of MLAs, particularly MLAs Bernier and Davies.
Next question is from Shannon Waters, BC Today.
Hello, Premier. I wanted to ask about your government's proposal on permanent paid sick leave that is being surveyed at the moment. When you introduced the temporary program in the spring, you said that the 3 days were adequate for people who might have symptoms of COVID to get tested, get their results, and possibly take advantage of federal programs to support them. Your government now has 3 days of permanent leave as one of the options on the table. Do you think that's adequate annual leave for BC workers who are sick or injured?
Well, we were hopeful, and I'm proud of the work that we did to drive the federal government to create a national program in this area. It didn't meet the test, quite frankly, and we brought in fully funded 3-day sick leave for British Columbians as a stopgap to the consultation that's underway now. I don't want to prejudge that by suggesting that I have a preferred position. This is a dialogue with workers, with employers, and we're going to try and find the best way to protect workers, to keep the economy going, and to make sure that the costs of that are separated and spread around as best as they can be. That's the whole point of the consultation, so I don't want to suggest I have a preference. My preference is to have sick days for British Columbians, as was highlighted by Isabel McKenzie. That was one of the challenges in our long-term care sector, and of course there were paid sick days when there were collective agreements protecting people. Those were diminished and eroded over time, and we're trying to revive that.
Follow-up?
Yeah, going back to the Seniors Advocates report, it seems to suggest that 6 days of paid sick leave, which some workers have access to, was not adequate to curb outbreaks in long-term care. 2 of the 3 options that your government is presenting are less than 6 paid days, and the maximum option is less than what the federal government is promising for federal employees. So I wanted to put a question to you that someone put to me while I was covering this. Given that the federal government is bringing in this requirement that multiple other democracies across the world already have, 10 days or more, what could be the reason or the excuse for a social democratic government in BC to be offering less than the 10 days of paid annual sick leave?
When we started the consultation, we didn't have the benefit of Isabel McKenzie's report. Once we started the consultation, we did so mindful that the federal government had rejected the notion of having a national program and instead focused on federal regulated workers who would be largely covered by collective agreements. So many of those employees would already have access to the 10 days that you're suggesting. Again, you can't have a full and true consultation if you prejudge the outcomes. And I have in my mind what I believe is the right way forward. We're wanting to make sure that, as with many things since I had the privilege and honor to hold this position, I want to make sure everyone fully understands the consequences and choices of the decisions we make. And that's why we've laid it out the way we have.
Next question is from Richard Zussman, Global News.
To the point Rob was asking
No,
about...
Richard, can you start again, please?
Yeah, to the point that Rob was asking about, Premier, I just spoke to the chair of the school board in Mission. She said she has no medical training, no medical understanding, that she would feel completely and totally uncomfortable voting on whether a mandate for vaccine should be required in the school system. Is it fair to put medical advice on trustees to make decisions on when this entire pandemic, your government and yourself have said the medical decisions will be up to the medical officials?
Well, that particular trustee and any other trustee can access the expertise of Dr. Henry and her team at the Public Health Office anytime. They are duly elected. They have a responsibility to their employees, first and foremost, and I would suggest that they can educate themselves with a simple phone call to get the details and data that they need to make informed decisions.
Follow up, Richard?
So the suggestion then is Dr. Henry is responsible for communicating with board chairs and trustees in 60 communities? Or is it up to the health authorities? I don't understand how the progression is supposed to work in terms of who is responsible here for, ensuring they have the information to make these decisions.
Well, again, I appreciate the question, and I understand that the objective would be to have us direct and order various parts of the economy to take certain actions, and we have been doing that for the past 19 months. So I appreciate the context of the question, but we are not the employer in this case. We are ready and able. Minister Whiteside has got a team in place. If there's any need for more information, we will provide it. But there is a responsibility for elected representatives who put their hand up and said, I'd like to be on the school board, to inform themselves about the best way to protect their employees and the children within their district. And I don't mean to be accusatory here, but there's no shortage of information. We know without any doubt that the vaccines available today are safe, they're effective, and they're free. And there's very few good rationales for not proceeding to protect yourself and your community. And these particular trustee in question, I'm certain if they put their mind to it, would be able to find more than an ample amount of information from very reputable sources about the value of proceeding in this direction. But they're the employer.
Tanya Fletcher, CBC.
Yeah, Premier, new independent modeling this week found that cases are on the rise in children under 12, and they're often asymptomatic. So with concerns rising about the number of kids in BC that are getting infected with COVID, how can you reassure parents, and what is the province anticipating or planning when it comes to getting them access to vaccines as soon as they're available?
Well, we did. Thank you very much, Tanya, for the question. And that anxiety and concern is, real. I fully understand that. People are taking steps to protect themselves. They want to make sure that government and school boards and various figures within the schools, whether they be administrators or teachers, are doing everything they can to keep children safe as well. The mandatory mask mandate is a part of that. Making sure that every adult in the system is vaccinated is another part of that. And we did an unprecedented amount of immunization over a short period of time, again, leading the country with Quebec. So when Health Canada approves immunizations or vaccines for 5 to 11-year-olds, we will step in immediately and maybe well do it through schools. We'll have to see what the timing is on that, what the logistics are. But health authorities have done an outstanding job to this point, and I'm confident they'll continue to do that as we get through the pandemic.
Follow-up, Tanya?
Please, thanks. Regarding the BC vaccine card, we're hearing about some delays and tech glitches from several British Columbians still trying to navigate the system. Have you been made aware of any issues? And in that context, how would you characterize the rollout of this program in BC?
Are you referring to individuals trying to create their immunization card, or businesses using their technology or reviewing the card once it's been downloaded? I'm not sure which that was.
Yeah, so specifically it's individuals who, for example, if they got one version of the vaccine and not the other, it's not recognizing it when they try to download the app or on the app. And yeah, just various issues for individuals, I suppose. So that's the context of the question.
Well, thanks for that. Well, I've not been made aware of large numbers of people frustrated by the system and the technology. I know when my spouse and I did it, it took a couple of tries because I kept pushing the done button before I had taken a screenshot. So it took a call to the health minister to get the advice that he took, which was to do it again. And it worked for us. But I do appreciate that sometimes there are transcription errors on the actual health identity number. Sometimes names are spelt differently, and we're working on those anomalies as they emerge. But I encourage people, if they're having difficulty, contact their local MLA, contact the local health authority, and people will be there to assist them to get the immunization card downloaded so they can join the 3.4 million British Columbians who have already done so.
Next question is from Lisa Yuzda, News 1130.
Good morning, Premier. I guess good afternoon. You said earlier, that there's very few good rationales not to protect the community, and you talked about saying that vaccine mandates are a last resort. But, your workplace is mandated to have vaccines, and when it comes time to negotiating teachers' contracts, the buck stops with you. So with all these issues, with the pressures of Delta variant, and with the massive concerns of parents and teachers in schools, why aren't you, why can't you, why won't you step up and just do it?
We are doing it. Minister Whiteside was pretty clear yesterday. We stand ready to work with elected school boards to achieve the results that we all want to see. We all want to make sure that we're maximizing the protection of individuals in the workplace, and most importantly, at this stage of the pandemic, our kids in our classrooms. I know that, as I've said, the BC Teachers Federation and CUPE have supported the notion of moving in this direction. I think it will be done in short order, but we have to respect jurisdictions here, and the school board trustees work tirelessly to keep their schools going in their districts, and they're as diverse as British Columbia. What's needed in Souk is not the same as what's needed in Vancouver, which is different from what's needed in Valemount. So we want to make sure that everybody has access to the information. To have all of the stakeholders on the same page is a glorious thing when it comes to these types of initiatives. But again, we're down to a very few people who have not voluntarily received an immunization. The province is leading by example by mandating all of our employees to do that. And I'm confident that school districts will be heading in that direction very, very quickly.
Follow up, Lisa?
Yes. With respect, it seems like you're picking and choosing where you have jurisdiction, not just with schools, because again, you negotiate the contract when it comes down to dollars, and even BC ferries.
That's not correct. We negotiate with BCPC, which is an amalgam of districts and the province. The districts are the employers, so it's not about picking and choosing. It's about bringing everybody along. I'm sorry to interrupt your question. I'll have you ask it again, but it's just not the case that we are the funder, to be sure, but there is a dual relationship here between trustees and the government. Sorry, you can try me again.
That's okay. And just with that and with ferries, because the perception is to a lot of people that the province could, and yes, it may be a little, maybe it's perceived as an overstep, but I think this is one, when you're mentioning how many people in the province have been vaccinated, those are the people who are going to support everyone else being forced to be vaccinated or not work with their children or not ride on the ferry. So it just seems, I think, that people feel like you're not going far enough in this instance.
Well, I believe we will in time and in short order. With respect to BC ferries, they are federally regulated. All employees on BC ferries are required to be immunized. And also, we have to keep in mind that it is an essential service. If you live in a coastal community, you live on Vancouver Island, and I believe the mask mandate, we had an incident just this week of individuals defying the mask mandate on board, and there were consequences for that. Again, I'm hopeful that over time we will have sufficient immunization in the community to get into the 90-95% range. And obviously, Dr. Henry is always hopeful for 100%. But we also need to make sure we're bringing people along. And I do agree with you very much that this is a majority issue. It's not a partisan question. It's not everybody of all political persuasions is getting immunized in extraordinarily large numbers. And again, if opinion polling says over and over again that numbers in the 80s and 90% support these initiatives. And I'm confident that we'll get there. But I believe that that we're doing it in an appropriate manner, and particularly when it comes to K-12, because we have dual responsibilities here. And I don't want to say to trustees who put their name on a ballot, got elected, and have been working hard to represent the needs of their community that if they need access to information, we're here to give it to them. But they need to make these decisions with us, not because of us.
Penny Dufflo, CTV.
Oh, hello, Premier. Despite the announcements of funding and hiring more staff, we're continuing to hear stories of people who call 911 and are put on hold waiting for an ambulance to answer, then waiting extended periods of time for paramedics to arrive. You know, some families are even experiencing family members dying while they wait on hold. Is this situation acceptable to you?
No, it's not. And it's not acceptable to the Minister of Health. It's not acceptable to British Columbians. But we have an extraordinary situation that we find ourselves in, starting from the beginning of the pandemic and the challenges of the opioid crisis, compounded with the heat wave, the heat dome in the middle of all of that. And that's put an extraordinary strain, as you know full well, you've been covering this for some time, an extraordinary strain on frontline workers. And that's why the Minister and others will have more to say on that in the hours ahead, if not by tomorrow, in terms of how we're going to try and fill some of these gaps that you've identified by your question.
Penny, do you have a follow-up?
Well, thank you for that answer. I do have another one. Premier, you've been really proud of BC's handling of the pandemic, but the fourth wave really has been nothing to be proud of. By every metric, we've been far worse than Ontario. Currently, at this moment, we've got quadruple the active cases, more than twice as many deaths on a per capita basis. So our Delta wave has our entire healthcare system on the brink, and it seems like we haven't been learning from Ontario, where their fourth wave is barely a ripple. It's a marked difference. So how much responsibility do you accept for what was demonstrably a largely avoidable fourth wave?
Well, I disagree with your premise. It wasn't an avoidable fourth wave. It's happening around the world. British Columbia is not immune to that. New Zealand, who fought courageously to say we will have no COVID here, has conceded to a pandemic. And of course, I know that the government there will continue to do everything they can to protect their citizens and keep their healthcare system going. The difference largely between Ontario and ourselves in this instance is that we have moved to keep our economy moving, and we have tried to make sure that the immunization access is as available as it possibly can be, but we have pockets of resistance to that good sense, and that's where we're seeing the increase in cases. That's where we're seeing the hospitalizations, and we want to see those numbers come down, and that's why we're continuing to encourage people voluntarily to get vaccinated, and within the public service, that's now mandatory. BC Hydro will be moving in that direction. BC Ferries is already there for employees. Again, I take full responsibility for the success and failure of the government, but I believe that we are doing everything that we can to protect people, and we'll continue to do that.
Last question today is from Victor Kaiser, Radio NL.
Hi, Premier. Thanks for taking some time here today. I just want to go back to Kamloops' favorite topic, which is the cancer center. You, on our airwaves, said that you promised cancer care for Kamloops it's gone before the Treasury Board, is what we were told. Turns out that is not the case. And as well, during the election, Premier, and after as well, you said, I guess, it will be running within your 4-year mandate. We're now told it's 10 years, and Minister Dix has told us that a few times. So what I'm wondering is, specifically what work has taken place to this date with regards to cancer care here in Kamloops?
Well, the first year, it's a 10-year cancer plan, not confined to Kamloops, but for across British Columbia. We are working at Treasury Board to get the dollars to put in place protections for people in Kamloops so they don't have to travel to Kelowna to receive treatment. That was the initial genesis of the notion of putting more cancer services in Kamloops. And I know Minister Dix is diligently working on that, as he is on a number of other files. Our commitment to Kamloops remains the same. We're going to keep working at that to make sure we get the services people deserve in that community.
Victor, do you have a follow-up?
I do, yeah. Premier, I know I appreciate the 10-year plan on that front. I know it was you on our airwaves who said 4 years. I think it was actually during a stop at TRU, in fact, that you said it'll be within 4. And if that's not the case, you'll come on NL and tell people of Kamloops that that is not the case. So I'm wondering if it isn't within 4 years, then when can we maybe expect you on one of our talk shows here?
Well, I would turn that around and say I have not been on your talk show yet, so that means we're moving in the right direction. When we get to the place where we're not, I will fulfill that commitment to your network. But the commitment, as you know, is to the people of Kamloops. They deserve this service, particularly as a cancer survivor. I fully understand the strain and stress on travel if you have to receive treatments in a distant community. That's why we made the commitment, and that's why we'll fulfill it.
That's all the time we have for today. Thanks for joining us.
Thanks. Nice to see you.